Hello future physios, welcome to our new topic. I'm your host Vaishak. Today we gonna discuss the topics paraffin wax, hydrocolloidal packs, infrared radiation, shortwave diathermy, microwave diathermy. So let's do not waste much time. Let's move to question number 1. What is the recommended wax to oil ratio for paraffin bath in most clinical application? Option A 1:1, option B 4:1, option C 7:1, option D 10:1. And the answer is option B 4:1. Now let's move to question number 2. Which application technique is most suitable for treating larger flat areas like the back? Option A dip and wrap, option B brushing or painting, option C immersion, option D pouring. And the answer is option B brushing or painting. Now let's move to question number 3. What is the primary mechanism of pain relief in paraffin therapy? Option A gate control activation, option B increased collagen extensibility, option C reduced nerve conduction velocity, option D muscle spindle inhibition. And the answer is option A gate control activation. Now let's move to question number 4. Why is paraffin wax preferred over water-based heat packs for hand therapy? Option A higher specific heat capacity, option C conform better to joint contours, option C prevent skin maceration, option D deeper tissue penetration. And the answer is option C prevent skin maceration. Now let's move to question number 5. What is the core material inside hydrocolloidal packs? Option A silicate gel, option B bentonite clay, option C paraffin wax, option D cellulose fibers. And the answer is option A silicate gel. Now let's move to question number 6. What is the maximum recommended treatment duration for hydrocolloidal packs? Option A 10 to 15 minutes, option B 20 to 30 minutes, option C 45 to 60 minutes, option D 2 hours. And the answer is option B 20 to 30 minutes. Now let's move to question number 7. Which factor most affects heat transfer efficiency in hydrocolloidal therapy? Option A pack temperature, option B towel thickness, option C body fat percentage, option D room humidity. And the answer is option B towel thickness. Now let's move to question number 8. What is the primary mechanism of heat transfer in infrared radiation therapy? Option A conduction, option B convection, option C radiation, option D evaporation. And the answer is option C radiation. Now let's move to question number 9. Which wavelength range is considered therapeutic for IRR in physiotherapy? Option A 100 to 400 nanometers, option B 700 to 1400 nanometers, option C 780 to 1500 nanometers, option D 3000 to 4000 nanometers. And the answer is option C 780 to 1500 nanometers. Now let's move to question number 10. Which type of IRR source emits the majority of its energy in A band? Option A non-luminous lamp, option B microwave generator, option C sunlight, option D luminous lamp. And the answer is option D luminous lamp. Now let's move to question number 11. Which law states that the intensity of radiation is inversely proportional to the square of the distance from the source? Option A Arnold-Klotz principle, option B Gauss-Dapper law, option C inverse square law, option D cosine law. And the answer is option C inverse square law. Now let's move to question number 12. What is the maximum penetration depth of IRR in skin for therapeutic A band? Option A 0.1 mm, option B 1 mm, option C 3 mm, option D 10 mm. And the answer is option C 3 mm. Now let's move to question number 13. Which tissue type absorbs the most heat during SWD using capacitive electrode? Option A bone, option B subcutaneous fat, option C muscle, option D cartilage. And the answer is option B subcutaneous fat. Now let's move to question number 14. What is the main difference between capacitive and inductive SWD electrode? Option A capacitive electrode use magnetic fields, inductive use electrical fields. Option B capacitive electrodes create stronger electrical field Inductive creates stronger magnetic field. Option C, both use only electrical fields. Option D, both use only magnetic fields. And the answer is capacitive. Electrode creates stronger electrical field. Inductive creates stronger magnetic field. Now let's move to question number 15. Which of the following is a thermal effect of SWD? Option A, decreased blood flow. Option B, decreased oxygenation. Option C, reduced cell metabolism. Option D, increased collagen extensibility. And the answer is option D, increased collagen extensibility. Now let's move to question number 16. Which tissue is least affected by SWD? Option A, muscle. Option B, fat. Option C, bone. Option D, cartilage. And the answer is option D, cartilage. Now let's move to question number 17. Which of the following is a non-thermal effect of SWD? Option A, increased microvascular circulation. Option B, decreased cell metabolism. Option C, reduced ATP synthesis. Option D, inhibition of phagocytosis. And the answer is option A, increased microvascular circulation. Now let's move to question number 18. What is the effective penetration depth of 2450 MHz microwave diathermy? Option A, 1 mm. Option B, 3 mm. Option C, 3 cm. Option D, 10 cm. And the answer is option C, 3 cm. Now let's move to question number 19. What is the main mechanism of heat production in tissues during SWD? Option A, conduction. Option B, friction from oscillating ions and dipoles. Option C, reflection at tissue interface. Option D, absorption by bone only. And the answer is option B, friction from oscillating ions and dipoles. Now let's move to question number 20. Which of the following is a contraindication for SWD? Option A, osteoarthritis. Option B, acute inflammation. Option C, chronic pain. Option D, muscle spasm. And the answer is option B, acute inflammation. So that's all for today. If you have any doubts, please do mention in the comment box. I have given the explanation in the description box, also in the Telegram channel. So please do read it. And do well for your exams. And see you in the next week. Bye bye. Thank you.